Hey everyone. So I just wanted to hop on and give an update of what I've learned this last week in school. So just continuing on like supplements, minerals, things like that. So the primary dietary supplements, I'll kind of do a brief breakdown of each that we studied this week. But the first one was CoQ10. CoQ10 is a compound that's naturally found in the body. It helps produce cellular energy and it acts as an antioxidant. Common uses for CoQ10 is it helps to support heart health, and especially you'll see it used in patients who take statin medications that have like muscle aches or myalgias. The CoQ10 can be beneficial for patients with that are taking statin medications. One caution that I learned about CoQ10 supplements that I was not aware of before this course was that patients who are on Coumadin probably should avoid it, just because CoQ10 in the body works similarly to vitamin K, which my medical people may understand what that means, but one medication we give to reverse Coumadin in patients where the blood is too thin. To make it thicker would be vitamin K. So we would not want a patient taking CoQ10 because it could potentially make their Coumadin not as effective. So meaning the blood may be on the thicker side versus being thin, which is the purpose of Coumadin. So CoQ10 should be avoided or just really closely monitored in patients that take Coumadin. So if you take Coumadin and you're thinking about taking CoQ10, please talk with your provider prior to doing so, just so they can be in the loop and help support you if that's something you choose to do. Next one we focused on were kind of two together, but they tend to be used simultaneously, is glucosamine and chondroitin. Those, for most people, are pretty familiar, but they're found in the cartilage. And so basically people will take that supplement to help with joint health. The next two we learned about, I'll try my best to say these correctly, but lutein and zeaxanthin. So those are antioxidants for the retina of the eye. So you'll often hear those supplements or dietary supplements to help with support eye health. And then the biggest thing you'll hear for it is potentially having preventative effects in age-related macular degeneration. The next one we studied was melatonin. That one is actually a hormone. It's naturally produced in the brain, and that helps to regulate our sleep and wake cycles. And it's a very powerful antioxidant. Some foods that contain melatonin are flax seeds, tart cherry juice. That's why if you've ever heard drink some tart cherry juice before bed, that's why you may have heard that. Also, walnuts, almonds, and raspberries contain melatonin. Some things with melatonin. So ideally, you want to start with lower dose, so kind of like 2 to 3 milligrams nightly. There are some higher doses that exist, but for some people, it may be too much. Ideally, you shouldn't take doses above 10 milligrams of melatonin. Kind of one of those more is not always better, because some people will experience insomnia with taking too high of a dose of melatonin. So just kind of like I've mentioned previously, more does not always equal better. It's really about creating a state of balance in the body and supporting the health, not trying to fix it, not trying to like force it into a certain state, but just how can I help to support my body. Melatonin, there's like two primary types. There is like an immediate release. So that one typically you'd want to take 30 minutes prior to bed. And then there's a sustained release. The benefit of the sustained release would be if you take the immediate release and then you find like 3 to 4 hours later into sleep, you're like wide awake again. It's probably because melatonin is out of your system. So you may be somebody who benefits from the sustained release, as it will give you a bigger window of time that the melatonin is still effective in the body. The next one we studied was omega-3 fatty acids. So those are very essential fats. They're commonly found in fish, so such as salmon, tuna, sardines. Additionally, they're found in walnuts, chia seeds, flax seeds, and hemp seeds. So a simple way I like to get omega-3 fatty acids in my diet is sprinkling a combination of the chia, flax, and hemp seeds on like oatmeal in the morning or on yogurt. Just really increasing my fiber intake as well as my omega-3s with those. With flax seeds, it's important to make sure it's ground, and then that one is one that tends to do better if it's refrigerated from a stability standpoint. Things that omega-3 fatty acids help with: it helps support the heart, the brain, eye, and joint health. And it's also been shown to potentially lower triglycerides and to reduce inflammation in the body. Other ways people may take omega-3 fatty acids would be like in fish oil capsules. And one thing I learned from the course is if you've ever taken them before and if you've ever experienced burping, that's a sign that it's probably not a very good quality fish oil. So if you're consuming a high quality fish oil tablet, you should not experience those dreaded fishy burps. If you do, it's probably a sign it's not the best quality fish oil. Another thing I learned, so with omega-3 fatty acids in dietary form, so like we talked about fish and seeds and walnuts, there is not any increased risk as far as atrial fibrillation, but there was in patients taking like fish oil supplements and kind of like higher dose, there was some studies that showed an increased risk of AFib, which is irregular heartbeat. So just being like really cautious in the dose that we take. Just like I said again previously, more is not always better. And ideally, if you can get it from the natural sources, that would be optimal. Other potential risks with omega-3 fatty acids, there is potential bleeding risk. So like prior to surgeries, that's why they tell you to hold like fish oil supplements. If you're consuming fish to get omega-3 fatty acids, just considering the amount that you're consuming in a week, because there is potential of like heavy metal concerns such as like mercury. I think that's all I have to say about that one. Next one is probiotics. So some probiotics, an important thing I learned, are grown in milk protein. So in a patient with a milk allergy, you really want to ensure that the probiotics were not grown in milk. Common uses for probiotics is it helps with digestion, bloating, irritable bowel symptoms. And the biggest thing that it has scientific studies supporting is in antibiotic-associated diarrhea. There's a wide range of probiotic strains that are commercially available. Different probiotics are beneficial for different sites in the body. It's really important to note like what strain you're taking of the probiotic, because some work better in the GI tract versus some in like vaginal mucosa for those who experience like yeast infection. So the strain of probiotic really does matter as far as whether or not you'll see benefit from taking it. A good indication that you're taking a higher quality probiotic would be that like on the labeling of the bottle, it should have the genus, the species, as well as the strain of the probiotic on the label. If it doesn't have all three of those things, likely it's not a high quality probiotic that you're taking. The dosage of probiotic varies based on the preparation of the probiotic you're taking as well as the condition you're treating. And probiotics tend to work best when they're used as a support. So it's not the only strategy. So ensuring to pair it with adequate fiber, lower processed foods, and anything to help like decrease gut inflammation. So that's what I learned this week. Hopefully you learned something new. If you did, post it in the comments. And I hope you have a great week, and I'll talk to you all soon. Take care. Bye.